Hello there. Thank you for joining us today. We want to spend a few minutes to talk to you about a couple of very serious topics that we have been facing here in Plantation. One is stroke. Spend a little time, we want to talk about strokes and stroke awareness, and more importantly, we want to discuss how COVID has impacted people's ability to get help when they're experiencing stroke-like symptoms or any other serious emergency. So we're pleased to be joined today by two amazing people. First, we have Barbara Simmons, the Chief Executive Officer for Westside Regional Medical Center. Barbara's been an icon in the city for many, many years, particularly within the medical community, and we've known each other for an incredibly long time. We won't even say how long.
More years than we want to
More years than we want to admit to.
Yep.
And Robyn Huebsh, who is the stroke coordinator for Westside Regional. So we're right in her wheelhouse, and we're going to talk about strokes in great degree. So let's dive right into this, all right?
Sure.
And, strokes are one of the leading causes of death in the United States, and certainly one of the primary causes of permanent disability, all right? And we always say when we deal with heart attacks that time is muscle. When we talk about stroke, we say time is brain. What is a stroke? And why is time so critical when someone is experiencing stroke-like symptoms?
Absolutely, and thank you so much for having us. It's truly our pleasure to be here with you and to be able to speak to those people in our community. But yes, having a stroke is a serious life-threatening event. And as you mentioned, although we've done such a great job of keeping these patients alive, and it's no longer the leading cause of death, it is the leading cause of disability in the United States. So anything that we can do to minimize that is certainly what we're looking to do. So time is brain, and what does that mean when we say that? Every second or every minute that we're waiting, or you're waiting at home in order to get treatment, that muscle is dying, that brain tissue is dying. So really what we're here for today is to discuss those signs and symptoms of stroke, what you should do if you're having a stroke, and then what we can offer for you at the hospital.
Terrific. So, and I think one of the biggest things that we're encountering, and ever since this whole COVID thing has come out, is people not wanting to go to hospitals. There's a fear of a transmission of COVID and a fear that if I go to the hospital, I'm going to get COVID. And what we're seeing is people waiting until almost it's too late.
Yep.
So, Barbara, maybe you can explain a little bit about what HCA and what Westside particularly is doing to help reduce the risk of transmission
Sure.
of COVID and why people should feel comfortable going to the hospital.
So a lot has happened in the last 6 months, and we've come a long way. So we now are COVID testing every patient that comes into the emergency room, so we can ensure that we are not admitting a patient that's COVID positive and that we are isolating them. We are, as everybody else is, masking. We've talked about that a lot. Hand washing, social distancing is all very important. We have seen a significant reduction in the number of COVID patients at the hospital, but trust me, it's not gone. They're still there. So we continue to isolate them in specific units so that there's no ability to cross-contaminate. There's special nurses that take care of them. We ensure everybody has the appropriate PPE. We follow all the CDC guidelines, so we continue to be very stringent still on visitors. I know it's not very popular in the community, but we only allow one visitor in now. Again, we continue to follow all the CDC guidelines to ensure that we are isolating those COVID patients and protecting every other patient and the staff in the facility as well.
They're really taking every step possible
Absolutely.
to make sure that the patients are safe.
Absolutely.
So Robyn, tell our viewers, what is a stroke? What is it all about, and how does someone know if they're having a stroke?
So a stroke is when there is a blockage going to the brain. So there's lack of oxygen going to an area of the brain. This can occur by a blood clot or from plaque buildup. So when that oxygen is not getting to that area of the brain, ultimately that part of the brain dies. So signs and symptoms of a stroke, I think most people are very attuned to the facial weakness, weakness on one side of the body, slurred speech. But I also want to just kind of, bring into account some other stroke-like symptoms that may not be as apparent in somebody else. For instance, like an acute onset of dizziness with, nausea and vomiting associated, or acute vision changes, maybe double vision or blurry vision. These are also signs and symptoms, or could be signs and symptoms of a stroke, and should not just, kind of be put to the side. So, I encourage everybody, not only in yourself and your family members, but if you were, seeing somebody out in the community, if you were to notice any of these signs and symptoms, to please call 911.
And Barbara, we were talking just before we came on the air,
Right.
And Westside is recognized as a comprehensive stroke center. Now, for the average individual, what does that mean, and why is that different than another hospital?
So it's a whole different level of stroke care, of neurologic care. So we have neurology, we have neurosurgery on call 24/7, but we also have the addition of a neurointerventional suite and a neurointerventional physician on call 24/7.
And those are big words. So what does
that mean? So what that means is, neurology, many people are familiar with a neurologist, a physician that can assess your neurologic status, neurosurgeon, surgery. The neurointerventionalist, so that's a specially trained physician that if I come in and I have a clot in my brain, they take me to the special neurointerventional suite, and they use a series of catheters, balloons, coils. They can go through my groin up into my brain, and they can suck the clots out. If it's a bleed, they can put pellets and coils in to stop bleeding. So it's a very sophisticated method of minimizing the damage that a stroke can cause. So we are one of just a few, actually the only one in Plantation, but one of in the community of comprehensive stroke. So we are deemed comprehensive by AHCA, the Agency for Healthcare Administration, but we also went through the next step through the Joint Commission, and we are a thrombectomy capable stroke center through Joint Commission, which speaks to that neurointerventional. So we've gotten numerous awards as well. So I'm going to take a second and do a commercial.
Do a little shameless plug. If nobody minds, that's fine.
So this is really why, if you have signs and symptoms of a stroke, dizziness, any sign or symptom of a stroke, why Westside might be the place you'd want to consider going. Because we do have all these special services. But not only do we just have the services, we have a quality program. So for instance, this year we are the recipient of the 2021 Stroke Care Excellence Awards. We're at top 10% in the nation for the treatment of stroke, and we're a 5-star recipient for treatment of stroke for 2 years in a row, 20 and 21, all through health grades. And everybody that Googles, we all Google related to healthcare, the first thing you see is health grades. So we're very excited and honored to be recognized by health grades in our neuroscience services.
That's terrific. Congratulations.
Thank you. Thank you.
And Robyn, you touched on that when we first started talking about how the mortality rate or the death rate due to stroke has come down dramatically across the country. And it's due to a lot of this, isn't it?
Absolutely. Absolutely. I think that, it's the different treatment modalities are definitely enhancing over the years. And so being able to offer that at Westside Regional and to our community is very exciting. Terrific.
All right. So for the average person, all right, so I'm sitting home watching TV, doing whatever, getting aggravated at the news or something like that. And suddenly I notice something unusual, something different. Or even more realistic is a family member of mine notices something unusual. What do we do?
Call 911. I cannot emphasize that enough. With stroke, the time that we have to treat stroke patients is very limited. So within 4.5 hours of that symptom onset, we have the ability to give a medication called TPA or alteplase, and what that does is help break up clots in the brain. Once we pass that 4.5-hour window, unfortunately, those patients are no longer a candidate. So it's very, very important to call 911 as quickly as you can and get to the hospital.
And so that's where we get into that whole issue of people delaying or not wanting to go.
Yes.
And once that window closes, now we get into that permanent disability and possibly the death rate.
Which unfortunately we've been seeing a lot of with COVID. The incidence of patients coming in whose symptoms started this morning when they woke up but waited till 5 o'clock to come in, or the day before. And when talking to them and communicating with them, the number one thing that I'm hearing is, I was trying to do everything possible not to come to the hospital. I'm scared to go to the hospital.
Wow.
Rightfully so. I mean, I think a lot of people don't know what to do these days with COVID. So that's why we're here today, to encourage you to call 911, to promise you that at Westside Regional we are taking care of all of our patients and screening them for COVID and screening the community as well when they come in.
The most important message is the ER and the hospital are safe.
Yes.
They're safe for you, for your family to provide care.
Excellent. Excellent. You know, I want to throw one other thing on there, and you mentioned about Google searching. So when you Google search stroke, you come up with all kinds of interesting terms and things. One of the terms that pops up is a wake-up stroke. What does a wake-up stroke mean, and what is that important for the community to know about?
So a wake-up stroke is defined as, you went to sleep last night at 10 p.m. and you were normal when you went to sleep. And when you woke up this morning, at whatever time that was, we noticed to have, or you noticed, or your family noticed that you were having symptoms of a stroke. So we don't necessarily know when that stroke happened. Did it happen at 10:05 after you went to bed, or 5 a.m. just before you woke up? So there's a lot of variability in there as to what time or when that stroke occurred. We just know that it happened or was noticed once you woke up in the morning. So unfortunately, those patients that fall into that category aren't capable to receive that TPA or alteplase medication because of the unknown onset of the stroke. However, they are still capable for a clot retrieval or thrombectomy procedure if they have a large vessel occlusion. So we would still activate our stroke teams, do all of the same things that we would if we knew the exact time of onset so that we could treat them that way.
Great. So the bottom line here is don't wait. Don't hesitate till it's too late.
Absolutely.
Stroke does not have to be debilitating. It does not have to have the fatality rate. People have to recognize it right away and respond right away. And they need to understand that Westside Regional is doing everything possible to reduce the risk of COVID transmission at every possible level. So again, folks, critically important. Don't wait. If you have symptoms of a stroke or any other critical emergency, call 911 immediately. All right? And thank you both for stopping in and chatting with us today.
Thank you.
And folks, please remember, wash your hands, wear a mask, and keep your distance. Stay safe, everybody.
Thank
Thank
you.
you.
Thank you.